Hello and welcome to the Arc of Virginia's presentation about the CCC Plus Medicaid Waiver. This presentation is by Lucy Cantrell, the Arc of Virginia's Director of Information and Resources. Please feel free to contact Lucy at 804-649-8481, extension 104, or email info@thearcofva.org. Maybe you are wondering why there's a picture of an iceberg on the side. It is because there's so much to know about the CCC Plus Medicaid Waiver Program. In this presentation, we will just cover the tip of the iceberg about the CCC Plus Medicaid Waiver. If you are new to the Medicaid waiver, this is a good place to start. First, a word about the Arc of Virginia. It is a statewide advocacy organization made up of people with a developmental disability, their family members, and their allies who are fighting for a life like yours for Virginians with or at risk of a developmental disability. As you can see, we are engaged in public policy and advocacy, offer individual and family support, and host an annual statewide convention each year, and this year will be in Richmond, July 31st to August 2nd for the 2023 statewide convention. And we have so much more to offer. Now, in this presentation, we will cover Medicaid health insurance, Medicaid waivers, and specifically the CCC Plus Medicaid waiver, its services, the eligibility criteria, and how to apply for the CCC Plus Medicaid waiver. Medicaid can be a very confusing topic. If you are confused, you are not the only one. It is because its rules are complex and change often. Policies change, requirements change, and the public health emergency brought about many changes that will soon be changing again. Change is constant. So what is today may change at any time. If this is important for you, we encourage you to stay informed by signing up for the Arc of Virginia's alerts on our website. It is helpful to have a basic understanding of what Medicaid is. Virginia Medicaid health insurance, low cost and no cost health coverage based on income limits. The health programs included in Virginia Medicaid health insurance for children, pregnant women, and adults. To find the programs and income limits, go to coverva.org. Every state has a Medicaid program. There are mandated services that are in every state's Medicaid program. These services are family planning, health clinics, home health services, hospital services, lab and x-ray services, transportation, Medicare premiums, nurse midwife services, nurse practitioner, nursing facilities, physician services, and EPSDT up to 21 years of age. Let's look next at what EPSDT is. EPSDT stands for Early Periodic Screening, Diagnosis, and Treatment. These Medicaid benefits are for children and young adults up to their 21st birthday. These benefits are designed to prevent health and disability conditions from occurring or worsening. The treatment is to correct or improve the conditions. The Medicaid EPSDT benefits includes assistive technology, hearing aids, private duty nursing, behavioral therapy, personal care, medical formula and nutritional supplements, and specialized residential treatment. And remember, EPSDT benefits are only available up until the 21st birthday. States may select other services to include in their Medicaid program, so understand that every state's Medicaid program is different. Virginia has selected these optional services: case management, podiatry, hospice, intermediate care DD, mental health services, optometry, PT, OT, speech, prescriptions, prosthetics, psychology, and waivers. Now we are going to learn about Medicaid waivers, often called home and community-based care waivers. What do waivers do? Waivers provide alternatives to institutionalization because they provide supports and services that enable a child or adult to live in the community with the care they need rather than going to some sort of institution for care. A Medicaid waiver is a long-term support system for people of any age with long-term care needs, meaning they may well need services throughout their lifetime. Waivers provide a menu of services and supports for people to live in the community rather than a nursing facility or hospital-like environment. Waivers are the only public funding service for long-term disability supports. Now, we covered what Virginia's Medicaid health insurance program includes and Virginia's optional services. Let's look at the words Medicaid and waiver. Medicaid is the insurance that pays for waiver services. Waiver means that a state may waive that requirement service be provided to all people with Medicaid in the state. Instead, waiver services are for select populations. So when we put the two words together, Medicaid waiver, a person has Medicaid health insurance that pays for the waiver services. But remember, waivers only serve select populations. A very important fact is that when a person has a waiver, parent or family income never counts. There is no resource limit for children. However, once a person reaches 18, then there are financial criteria that must be met. For adults, the monthly income limit is $2,742 per month in 2023. The resource limit is $2,000 per month. If a child or adult meets the criteria for a waiver and is enrolled in the Medicaid health insurance program, then they have the Medicaid Health Insurance card, which is now called the Cardinal Care. This year, Virginia is rebranding Medicaid to Cardinal Care. The person with the Medicaid waiver is eligible for services in their waiver. They likely are enrolled in a Medicaid managed health care plan. Virginia has two Medicaid waiver programs that people with disabilities often have. They are the Developmental Disabilities Medicaid Waiver and the CCC Plus Medicaid Waiver, which stands for Commonwealth Coordinated Care Plus Waiver. We are now going to learn about the CCC Plus Medicaid Waiver Program. Let's review the CCC Plus waiver services. There are 9 services in the CCC Plus Medicaid waiver. The services are adult day health care, personal assistance services, private duty nursing, respite care, services facilitation, assistive technology, environmental modifications, personal emergency response system, and transition services. Personal and attendant care is one of the most commonly used services. An attendant works one-on-one with a child or adult to provide assistance with the activities a person needs help with, such as eating, communication, dressing, bathing, toileting, mobility, and supervision. There are 2 ways that the waiver services can be delivered. In the consumer-directed method, the person with the waiver or their family recruits attendants, and they interview, hire, train, supervise, authorize timesheets, and fire attendants. In the agency-directed method, you contact an agency that provides personal care, and the agency provides the attendance and does all the administrative tasks. You may use both models at the same time. Assistive technology provides technology that enables a person to have greater independence in areas such as communication and mobility. Tech devices are usually portable. The amount of AT is limited to $5,000 annually. Effective July 2023, the limit will increase to $10,000 per year. Environmental modifications pay for modifications to a person's home or to their primary vehicle. Some examples for a modification in the home could be making the bathroom or kitchen more accessible. A vehicle may need hand controls for the person with the waiver to drive. The amount is up to $5,000 per calendar year. Private duty nursing is continuing care up to 16 hours per day. It is only available if it is not covered by private health insurance. People have to meet very specific criteria to have private duty nursing. Parents and caregivers all need a break from caregiving. Respite gives the parent or caregiver a break. Up to 480 hours of respite is available. This is a service that is consumer and agency directed. For a person living in a nursing facility who wants to move to a home in the community, up to $5,000 is available for expenses to transition to their community home. For people who are 14 or older, who are unable to use a phone in their home, there are electronic devices to get emergency assistance. This is called a personal emergency response system. There are also electronic systems to help people take medication. Adult day health care is provided in a group location during the day. The adults are typically elderly and can't be left alone. There are social and recreational activities included. Now, let's take a look at who is eligible for the CCC Plus Medicaid waiver. Certain diagnostic eligibility criteria must be met. A child or adult up to the age of 65 must have a disability. Mental illness alone does not qualify for a disability diagnosis. The person must have another disability in addition to their mental illness. The person must have a medical or nursing need. There is no complete list of approved medical or nursing needs. If a person is using some sort of device for daily function, requires wound care, has uncontrollable seizures, or has daily nursing that will likely qualify as having medical or nursing need. To meet eligibility criteria, children and adults must meet nursing facility criteria. The person must be at risk of nursing facility placement. Notice the emphasis on at risk of. Be sure to discuss this when you meet with the nurse who does the screening. Think about the person's condition, their support system, and what may occur that may lead to the person being at risk of nursing facility placement within 30 days. To recap, to be eligible for the CCC Plus Medicaid waiver, child or adult must have a disability diagnosis, they must have a medical or nursing need, and they must be at risk of nursing facility placement within 30 days. The child or adult seeking this waiver must meet functional eligibility requirements. This is determined with an instrument called the Uniform Assessment Instrument. It is administered by a nurse from the health department who meets with the applicant and family or others who know the person well. The UAI assesses the person's social, physical, health, and functional abilities. Functional abilities are those activities that we do every day, such as eating, toileting, bathing, communicating, mobility, dressing, etc. This assessment or screening is done by a team that includes a public health nurse and sometimes a representative from the health department. It may also be done by a hospital screening team if the child or adult is in the hospital. To apply for the CCC Plus Medicaid waiver, contact your local Department of Social Services. In some localities, you can contact your local health department. Be able to identify the disability or disabilities and what waiver services are needed. The child or adult does not have to have Medicaid health insurance to have the screening. If the person is eligible for the CCC Plus waiver and they don't already have Medicaid health insurance, then they must apply for Medicaid. If you are not sure that you and your family member will qualify, we recommend applying. You have nothing to lose. We strongly recommend that you contact a Medicaid waiver mentor in advance of requesting a screening so that you can be prepared for the information that you will need to provide. You may contact Lucy Cantrell, a waiver mentor at the Arc of Virginia, for waiver mentoring. The Arc of Virginia is here when you need us. Please use our resources on our website, YouTube, or contact us directly. To get started on applying for the CCC Plus Medicaid waiver, or if you have questions, please call or email info@thearcofva.org. And before we close, a few frequently asked questions and answers. Does it cost to be screened for the Medicaid waiver? No. Do I have to pay for Medicaid waiver services? In some situations, there is a patient pay, similar to a copay. Third, if I leave Virginia to move to another state, do I keep the Medicaid waiver? No, you no longer have the Virginia waiver. You have to apply in the state you move to. 4, is there a waiting list for the CCC Plus Medicaid waiver? There is no waiting list. And 5, my child is on the Developmental Disability Medicaid waiver waitlist. Can my child apply for the CCC Plus waiver while on the DD waitlist? Yes, a person can apply and use a CCC Plus waiver while they are on the DD waiver waitlist. We hope that this presentation gave you some helpful information about the CCC Plus Medicaid waiver. And as I said in the beginning, this is just the tip of the iceberg about the CCC Plus Medicaid waiver program. You will find more information about the Medicaid waiver on the Arc of Virginia's website and our other presentations about waivers. Thank you for listening today.